We also had some discussion. I think Senator Colcourse brought up the issue about the coverage gap and whether people are working hard enough or not. I think as I understood it. Can you speak to this? I mean, I think you all have got plenty of information out there about these are hardworking Texans that we've got.
There's obviously a whole range of people who fall into the working poor or the non-working poor. The majority of the folks in our coverage gap are in a working household. A lot of them are full-time. Some of them are headed by a part-time worker. Sometimes they're a part-time worker because they're not very healthy, but they're not sick enough to be on SSI yet, so they don't have that Medicaid coverage, but they're sick enough that it keeps them from working full-time. Some of them are taking care of a kid with disabilities at home, and that's why they're working full-time or not working at all. We also find a lot of, in addition to those very young families, particularly if you're trying to have one parent at home with the kids, it can be really easy at a starting salary to be below poverty. And so those are working families in our coverage gap. And then we also find a significant population of women, women and men over 50, between 50 and 65. And so that's an age where illness may have made it impossible for you to work nearly as effectively as long hours at the same level as you used to. And so your earnings drop down and it's easy to be below poverty. But you're not sick enough, again, to get SSI and therefore get Medicaid. So that's one reason you will hear folks from specific disease groups as well as advocates for Texans with mental illness talk about how, we could get a whole bunch of Texans who are not impaired enough yet to qualify for SSI into a medical home where they could get consistent mental health treatment if we came up with a coverage plan, including one with premiums and co-payments and incentives for healthy behavior and medical savings account, all those things that other states have added. So we really think that the opportunities are out there for Texas, and we hope that we'll start looking at the balance of benefits and
there was. Excuse me.
Go ahead, please.
I've got two more. There was some skepticism also about the federal government living up to its commitment on that 90%, coverage funding, and as a match, and so. I think I made the point, well, it's not up to CMS. That's legislative. You'd have to go to the Congress and change it. I mean, has there, to your knowledge, been any instance where the federal government has backed down on some of these?
Not on Medicaid or CHIP. We don't have any other comparable programs where we put up, billions of state matching dollars. So I think it's really important to understand that there is not a history of that. In fact, in CHIP, the match rate has gone up to between 90 and 95% now. So it's almost all federally funded. It's also a very small program in Texas relative to Medicaid for children. It is also the case that we heard those concerns. I've been here so long that we heard those concerns back when we were debating creating a children's health insurance program in Texas. And one of the things that Texas did was put into our CHIP bill a trigger that said if the feds back off on their, what was then a very generous match rate of around 75% on this, this is grounds for repealing or, going back to the drawing board. It hasn't happened before. What has happened, what the feds have allowed to deteriorate, and what Congress has allowed to deteriorate often, are block grants. So we have block grants like the Maternal and Child Health Block Grant and Title X and the Mental Health Block Grants, and especially the TANF Block Grant, that they've not made any attempt to keep up with population growth or inflation. Now, the CHIP Block Grant, they have kept up. So that's why when people ask about block grants, I say, you and I might create really different block grants. I could create a block grant that I would feel reasonably good about, but if it's one that Congress is going to ignore for 3 decades and every year it will lose buying power, that's not necessarily a good deal for Texas.
To that point, the Roberts ruling negated the mandatory expansion of Medicaid because of the coercive effects, and we as states are having left to deal with the issue of this coverage gap, which is in part of the ACA legislation, and it's incumbent upon us But isn't it also incumbent upon Congress and the federal government to work with us to solve that regarding flexibility and options that the states seem want to fashion a program that's correct? I just don't believe that flexibility has been offered to the extent that is appropriate for equal partners. Do you think the federal government is being all...
Well, Congress has not been very productive by almost anyone's measure on either side of the aisle, I would say, for the last several years. And certainly, the idea of tinkering with the Affordable Care Act has not been something they've wanted to talk about. But I think my impression is that I have watched CMS go further with states like Indiana and some of the other states than I would ever have dreamed they would have gone. They have really pushed things. In my circle of advocates nationally that I communicate with, the fact that I'm willing to come to the table and say, give me
but they
an
went back on
alternative coverage
Indiana
program.
In Indiana, there was a program that had co-pays and premiums, I believe, and CMS said, no, you can't do that. For that population, we got to treat everybody equally, and therefore you got to expand Medicaid if you want to maintain that program. So it really was more the hammer than the carrot.
They wanted to not expand Medicaid, and I think that's correct.
They wanted to maintain their program that they had in place, and the only way to maintain that existence of that program, because of the course of effects of CMS, was to subsequently expand Medicaid.
That's correct, and I think there may very well be a really fundamental philosophical difference in terms of
the role of the
federalism.
government.
In other words, I kind of think that everybody in the United States should have roughly equivalent access to things like education and health care. There shouldn't be a giant cliff when you cross the Red River. But other people's idea of what they would like to see the country be does not include that. I was somebody who did not think that the idea that we could block grant Medicare in Texas was a great idea, but people in this chamber voted for it. So I know that there's diversity of opinion on that. I feel like there's a lot of flexibility there. There's not... most of the time when I talk to conservative members, the things that they talk about are some of the things you mentioned, like premiums and co-payments and personal responsibility requirements and medical savings accounts. And those are things that are, in fact, happening in other states. And some of my colleagues in the world of advocacy for low-income uninsured think that that's terrible. But I think that I would be happy to see a program like that in Texas. I think that would be a huge step forward for low-income Texans. So
I think our degrees of freedom are different right now. Thank you. I appreciate it, Ms. Dunkelberg.